Will take. So I wanted to begin with Dr. Paul Farmer, who has been in Haiti for many years, to start off by giving us the contours, political, geographic, of Haiti, what is happening today and what you think needs to be done. We live in a globalized world, but when it comes to information, we are very insulated in this country in getting information of countries around the world.
Thank you, Amy. I would skip ahead to the very recent past, and you're familiar with a lot of this, but everyone has his or her own summation of what's going on in Haiti and what's going on recently. But I think there are some things that are incontrovertible. For example, we know that between 1804 and 1990, Haiti never had free and fair elections. And we know that in 1990, and again on two other occasions, there were free and fair elections in Haiti. And in each of those instances, with reliable unison, the Haitian majority voted for the same platform again and again. And some people have their way of describing this platform, but I would call it basically a very pro-poor people's platform for basic social and economic rights. The right to go to school, the right to not starve to death, the right to have medical care. And these are ambitions that may be not so familiar to a lot in an American audience. You know, the right to go to school, you could argue that's certainly a struggle that African Americans had to wage in the 20th century even. But for Haitians today, these are still very much, in addition to the right to vote and the right to free speech, these are also the struggles. So unfortunately, on a number of occasions, these elected governments have been overthrown, or undermined and then overthrown. And I think that's something we should talk about tonight. How did that happen? Who was involved? And I would just close my comments by saying that I'm headed back there tomorrow, and I know that I'll hear what I usually do when I go to Haiti. I'll hear about things like getting kids back into school. January is in some ways the hardest month. January and September, when kids have to go back to school. What about medical care? What about access to clean water? What about finishing roads? And above all, what about jobs? So this same refrain is something that I've been hearing now for a quarter of a century, and I've learned a lot from Haiti and Haitians, and I hope that we can learn as Americans to learn how to respect Haitians and respect their right to choose the people they want to lead their country.
But if you could talk more about the challenges that Haitians face right now, everything from healthcare, education.
Well, if you look at the numbers on these issues, first of all, before I forget, the reason that Haiti was so devastated by these 4 storms last fall is because Haiti also faces an environmental and ecological crisis, which is tightly tied to the economic and political crises that I've mentioned. But if you look at the numbers, Haiti, our oldest neighbor, has the health indices are bad, not enough kids are in school, high rates of illiteracy, and also high rates of privatization of schools and healthcare facilities. So Haiti it's not an accident in my view, and I say this as someone who works with an NGO and works with church groups as well. It's not an accident that Haiti has the most privatized education system in Latin America and also has the most people who are literate, because it's not a right to go to school. It's something you have to pay tuition and get your books and your uniform and your shoes. And that really makes it very difficult for families living in poverty to say, I want my kid to go to school.
How did it all become privatized?
Well, this has unfortunately been an enthusiasm of the elites in countries all over the world to make things something other than a right, say a commodity. But in Haiti, I've worked in 10 countries, and you can't really know 10 countries well. And I feel like I know Haiti well, and maybe Rwanda and my own country. But of the 10 countries in which I've worked, this is taken to the greatest extreme, this privatization. It's really through public policies. And some of them, alas, have been championed by our own governments in the United States. Over the last 8 years, for example, all assistance to Haiti, or the great majority of assistance to Haiti, went through the private sector, NGOs, church groups, faith-based organizations, and very little of it went through the public sector. And without the public sector, how can you have public health, public education, public water? So a lot of it has been policies sometimes advocated by international financial institutions, sometimes by foreign governments, and tolerated by Haitian governments. But again, it's hard to know what Haitian governments would do if they were able to play out their time in office without being worried about being overthrown by some violent coup.